Good afternoon. This is Barbara O'Brien from the Office of Perinatal Quality Improvement. We're going to go ahead and get started. I wanted to share with you our news that Oklahoma has used some of its AIM funding so that we are able to do a statewide post-birth education program for our AIM hospitals. So I don't know if everyone is familiar with this. Just want to give you a little bit of background. When we attended, some of us attended the AWHONN convention, I think it was 3 years ago in Long Beach, California. There was a presentation on a study that has since been published regarding education that women receive post-birth before they go home. And in this study, it explained how most of the information that women received related to care of the newborn. And there was very little information given to women about their own care and when to seek medical attention. And they also showed in the study that the information that women received was very inconsistent. So AWHONN developed a post-birth warning signs education program, and we have been waiting for this to become available to us, and recently it has. So we are going to be launching this in September of this year. Wanted to give you all some information today on the program and how we're going to be administering it in Oklahoma. So I'm going to show you here the AWHONN website and the post-birth education information. If you can go to the AWHONN website to see this information yourself just by clicking on their post-birth warning signs logo that's right below their banner. So this is at awhonn.org/page/post-birth. And they just talk about how the information that I just gave you about post-birth warning signs. Wanted to give you a little bit of information here about what is part of the education here. And you can see the components of the post-birth warning signs program. You have the online education here, and this is what we will be giving to you as AIM hospitals in Oklahoma. If you meet requirements, you will receive this at no cost. The price that they quote here is $29. We've received a discount on this. We will be allocating registrations based roughly on number of annual births in your hospital, but that will likely change as we see who is registered and how many registrations we have available. So the online education course is basically takes about 45 minutes to complete. It gives a little bit of the history for maternal mortality and morbidity, which I neglected to mention, but what we see in Oklahoma and nationwide is that over half of all deaths and severe morbidity take place in the postpartum period, most in the first few days after birth or weeks after birth, but some even months later. So it is important that all women, not just high-risk women with complications, receive this consistent information. So all of the nurses are given that kind of information during this course, and then it talks about how to educate women and their families and the different components of this program. One of the things that has been a barrier AWHONN found in their research to providing this education is that nurses think that it might frighten patients and families. We give all sorts of information about other things and don't consider that it may frighten them. We talk about when to call the doctor, if your child has a fever, and, what kind of warning signs to look for. So I think just because we think childbirth should be a happy time, we're fearful of providing them with more information that we think could make them anxious. But when in reality, I think this information is empowering because it gives the women a tool to use to guide what they should be looking for and how they should seek care. So that is within this program too is a script that the nurses will receive, giving an example of how they can approach this topic with the mother and her family. So there is also a certificate of completion when the nurse completes this course, and they can receive 0.6 contact hours. So that's a big piece of the online. The online course is a big piece of this program. Other parts of it are the Save Your Life handout in English and Spanish. You can see on the website here you have links for those, and I'll show them to you in an upcoming slide. But you are free to go ahead and print these out, and they will be part of this, what you will use when you're providing the education to the women and their families. The discharge education warning signs that we talked about, the education checklist is also a component that you can include in your EHR so that it just documents what the woman was educated on prior to discharge. So I would encourage you to go to this website here. They have an FAQ page. They also have the ability for your hospital to purchase magnets and magnet templates. We are not providing that through our funding at this time, but you're free to do that on your own. And here on this web page, they also have an interview with a mother about her experience with a pulmonary embolism and how she used the Save Your Life handout to go to the hospital because she was educated to seek help if she had the difficulty breathing. And then they also have the different publications here that are related to this program. So all of these are on the AWHONN webpage. I would encourage you to review this. Another thing to let you know that we will provide you with a certain number of online education codes for your nurses. If you have more nurses that you want to educate yourself, you will be free to pay for those at our discounted rate if you want to purchase more. We will give you 6 months to complete this course for the number of codes that you have. At 6 months, you may be required to forfeit your codes so that we can give them to another hospital if you haven't used the codes that were allocated to your hospital. This slide here just shows you the Save Your Life handout and talks about, on the top you can see education on when to call 911, and then the ones in yellow are call your healthcare provider or go to the hospital if you have the other things listed. Very important also to emphasize that if a woman does call 911 or does seek care during this period, to ensure that she or her family notifies the healthcare providers that she did give birth on such and such date, and these are the symptoms she's having, so that all of the caregivers can understand that the woman is a postpartum woman. And then if you want to provide the other information at the bottom about who to call, they also have a place where you can put when their if they make an appointment, that you can put that on there too for their postpartum visit, which they are encouraging women to be seen within 3 weeks now postpartum, in addition to the usual 6 weeks visit. On the right side of the page, you also see here is the post-birth warning signs discharge education checklist. So talks about what the woman should be educated on for each of these topics. And I'm going to turn it over to Barbara Koop, who's going to talk to you about your requirements. We will have an opportunity for questions at the end of the call.
Good afternoon. These are the hospital requirements. You need to be a hospital that is participating in the AIM process. You need to make sure that your process measures have been completed through the first quarter of 18, and all of this needs to be submitted by the 17th of August. There will be an AIM survey that we will be distributing to all of the hospitals that are participating that has a couple of questions on it about post-birth education in it, along with other AIM information. And again, that needs to be submitted by August 17th. We ask that you collect and enter data into the AIM database, because we just this last couple of days got confirmation from them that they will include 2 structure measures and 2 process measures that are pretty basic, that has to do with patient education, nursing education, and policy and so forth. That you will, and Barbara already mentioned that you will need to complete the online training by March 4th. We have a limited supply of these kind of course coupon numbers that we can give to the staff out to each hospital, and we don't want them sitting there unused. So if they haven't been used by March 4th, we will be taking those back and distributing them to somebody else that needs more. The registration for this, you can see at our registration site here. We're going to ask that you submit this. Go to our website here. And second line. And that's how this is where you're going to go to fill out all of this information. It gives you those agreement hospital requirements again. And then we also ask that you select someone, whether it's managers. I think managers have an awful lot to do, but they can give this to an educator. I know we've got a lot of places that have safety nurses. We have assistant managers, somebody within your department that you would like to make the owner of this project. And then they ask you to list those additional people at the bottom of it. So we would ask, yeah, right down here. And we also ask how many of those codes that you're going to need for your hospital. And again, we're going to try our best to give you what you need, but we're just allowed to buy so many, so we'll do our best with that. We go on. To start the implementation of the post-birth warning signs, again, we're going to ask that you designate a leader, that you kind of have a plan in mind. What are the steps? How are they going to access the module? Go in, explain to them, whether that's through emails, posters, whatever. This is how you're going to access this, and this is what you're going to have to take. They need to have a set timeline for completion. If we kind of leave this, it's like many other things. If we leave it open-ended, it never gets done until the last day. So you might give them a timeline for when this is going to be completed. The other thing I think that's very important is working with your ED on this process. So many of the OB patients, when they come in through the ED. So you may want to get some kind of open communication going with them to find out how many of their patients, how many of the postpartum patients are coming back in, what those situations look like, because you may or may not see them depending on the size of the hospital. So you might work out a process with them how you can follow up with this. The other consideration is that you need to have a policy about post-birth warning signs education, specifying what some of the risks are, what they're looking for, how are you doing this education, that you are educating all women, because we know when we only educate the ones that have symptoms at the time that they leave the hospital, we lose a lot of these women. Didn't have any symptoms in the hospital, and when they go home and start having shortness of breath or severe pain or bleeding, they're not sure what to do about it. So we need to educate everybody. And then what is your unit process for discharge education? Is it your postpartum nurses? Do you have a discharge nurse? What is your process for that? I'm going to turn it over to Denise to talk about data collection.
Hello, everyone. As Barbara already mentioned, the data that we will be collecting with this initiative includes 2 structure measures and 2 process measures. And these are very similar to what we're collecting already through AIM with Every Mother Counts. So the structure measures are going to be, does your unit have a policy and procedure in place for post-birth warning signs education of all birthing women before discharge? And is your process integrated into the EHR? Those are just going to be where you enter in the structure measures. You either put that your hospital or the date that those components were put into place into your structure, or you can click that it is not currently in place. Then there are 2 process measures we're going to be completing. One for the cumulative proportion of OB discharge nurses that have completed the post-birth warning signs education. That would be the online education. And the other is the proportion of mothers receiving post-birth warning signs discharge education. We're going to ask that you start collecting data in Q4 of 2018, so this will be after our September rollout. And you can start entering that data after Q4 is over, beginning January 1st. And again, you can utilize the AIM data portal to provide that data. If the person that you have designated as your administrator does not currently have access to the AIM data portal, you can let us know. We can send them an invitation, or you can send an invitation if you are your hospital administrator. But if you need help with that process, you can just let us know. We don't currently have all of the details about how the process is that we're going to get the codes and that sort of thing. Today, we're just mainly wanting to just kind of set the background for this initiative. We are going to be having 2 webinars on August 21st and August 23rd that will be repeated, where we will go over the details about how, as the hospital administrator, you will be able to sign into an institution portal, enroll the staff from your facility that you want to complete the online education, and you will also learn how to run learner reports to see who has and has not completed the online training. The learners will need to create an AWHONN.org account, but they have assured us that AWHONN membership is not required for them to create an online account, but they do need to create something. They will be instructed on how to sign into the institution portal. Each hospital will have a unique URL or a link that they can use to sign in. And then from there, they will launch the course, and after completion, they will receive a CNE certificate for 0.6 contact hours. Some things you might want to consider working on between now and then. There are, of course, some technical requirements to be able to run this online education. So you would need to have an up-to-date browser. You can see the list there of acceptable browsers. And the browser settings need to have cookies enabled. Adobe Flash and Adobe Acrobat Reader are also requirements. So one thing you might want to go ahead and get started with is asking your IT department if they can add AWHONN.org as a trusted website. That might be a process that takes a little while, and so you can go ahead and get that ball rolling. And that's just going to ensure that any nurse who wants to, log on to the system to be able to perform the training can actually get access, and it's not blocked by the firewall.
I do have one more thing, too. You may be wondering which nurses should take this online education program. So basically, anybody who is involved in discharge of mothers, usually you're discharging mothers and infants, but all of those nurses and other staff, for example, your labor nurses, some of them, these women, if they come back to your hospital, may be returning to the labor unit. So I think all nurses should be aware at least of the post-birth warning signs and which nurses take the, and also working with your obstetrical staff, your providers who deliver babies at your hospital, include them in your planning so that all are aware this is going on in your hospital. And then certainly all of your postpartum or mom-baby nurses would take the education, and you probably will have extras to be able to include others as well. So I wanted to make sure you, when you're trying to figure out how many you need, we just want you to give us a rough estimate of how many you think you need. We may not be able to meet that request depending on what our numbers are, but we do have a fairly substantial number of codes. So we will likely be able to meet your request for that. And I think, is there anything else we forgot before we go to questions?
Something that I noticed as we were going through here and we were talking about the structure measures and having this part of your EMR system, we understand that that's not an easy thing to do, to add something to your EMR system. So therefore, you have a paper version of this available for your discharge education until the time that you can add it to your EMR. Don't let that keep you from participating.
The other thing I just thought of, you may be wondering about outcome measures. We do not have the capacity at this time to collect outcome measures such as, we have overall maternal mortality within the state, our severe maternal morbidity measures that we're looking at pretty much just have to do with the birth hospitalization, so they may not be included on this in this postpartum time. We do not have the capacity to collect readmissions at the state level at this time, but we would encourage your hospital to maybe be looking at that, gathering some baseline data, and then looking at changes in your readmissions, and you may actually see them increase, but because women are more aware of what's going on, but that might be a good thing. Hopefully these women wouldn't experience severe morbidity or certainly mortality because they did come in to seek care. So you may want to collect that data, how many women are coming back in, even if they're not admitted, how many are presenting to your OB/ED or your ED, and having an understanding of how that those numbers may have changed after you implemented the post-birth warning signs. Your doctors and their clinics may also want to collect this data because some of these women may be just coming in to the outpatient clinic and not in to the hospital. So we're ready to open it up for questions. If anybody has questions, you can either, we're unmuting your lines, so feel free to ask, or you can chat them into the chat box. So are there any questions?
I don't have a question, but I would like to say thank you guys for doing this for us because this is going to be really good.
Okay, thank you. Who was that?
That's
Christy?
Mm-hmm.
Thanks, Christy. Well, we appreciate that. We were excited about it when we heard about it, and we're glad that we can provide this. I know that it can be challenging, and it is another process to add, but I think it is important that we do provide this education to our women and their families. You will sign up on our webpage. It is, I can't see.
Can you just pull it back
Yeah,
up?
pull that back up.
I'll pull it over. It's opqic.org/postbirth form. So, and that is where our agreement to participate is located.
And we have added a tab under our initiatives. You can see here, AWHONN Post-Birth Warning Signs Initiative. So that's where you will go to register and for all the other resources. If there's anything that you have a question on, please email us or call us. If there's if you have any suggestions for us, we're learning too in this, so we appreciate. Y'all are the ones that are actually going to be doing this, so we certainly probably missed some things. So if you have some things to share that would be helpful or something that you need from us, please let us know.